Hello everyone, this is Marcia Oliver and I'm excited to tell you about my Health Policy Brief Semester project on House Representative Bill 3207. Project analysis on a bill to amend the Public Health Service Act to provide for a national program to conduct and support activities toward the goal of significantly reducing the number of cases of overweight and obesity among individuals in the United States. House Representative Bill 3207 regards obesity as a public epidemic and outlines specific programs and activities that address this important issue. Honorable Eleanor Holmes Norton of the District of Columbia introduced this bill in the House of Representatives on July 23, 2015. Recognition to Ms. Norton here is due to her dedication on this issue. She first introduced this bill and similar bills to Congress in 1999. Although there were no co-sponsors for H.R. 3207, Ms. Norton has been consistent with identifying to Congress that the U.S. is in need of a successful healthcare reform, including efforts to reduce healthcare costs, increase quality of care, and expand access to healthcare services. Healthcare providers need to make a clinical commitment to encourage physical activity and healthy eating among their patients. The bill has been referred to the House Committee on Energy and Commerce, then it was referred to the Subcommittee on Health. Unfortunately, once again, the last major action of this bill died in Congress, which met from January 6, 2015 to January 3, 2017. The target audience for this project is Wisconsin state representatives who need to pay attention to this issue and include Paul Ryan, Mark Pocan, Ron Kind, and Gwen Moore. So what is the issue? The issue is there are increasing rates of overweight and obesity are now found in Americans of every age, race, and major demographic group and threaten the health of Americans like no other single disease or condition. The United States continues to have startling rates of obesity among adults and children. This is a real problem. 80% of the current 13 million obese children will be overweight adults, with the health conditions that follow, such as high blood pressure, heart disease, and cancer. The consequences of obesity for kids will follow them throughout their lives if action is not taken quickly and decisively. Chronic diseases, many of which are caused or exacerbated by overweight and obesity, occur for 70% of all deaths in the U.S. In 2010, estimates from the CDC, National Center for Health Statistics, show that since 1980, the percentage of children who are overweight has more than doubled, and the percentage of adolescents who are overweight has tripled. What are the experts saying? A little bit of background that this bill highlights. It is estimated that between 300,000 and 400,000 deaths per year are related to obesity. The prevalence of obesity in the United States is alarming, with more than 1/3 of adults and 17% of youths are considered obese. Patients are overwhelmingly wanting their providers to talk to them about diet and physical activity. Each month, an estimated 20% of the U.S. population visits a provider's office, placing the healthcare system in an ideal position to influence people. 117 million, or about half the adult population, who have one or more preventable chronic disease, which includes cardiovascular disease, type 2 diabetes, obesity, and being overweight. Some history on how does obesity impact healthcare costs. Cost plays an important role in any policy, therefore identifying the costs related to obesity is key to this brief. The rising costs of healthcare system includes insurance premiums and reflects this epidemic. 60% of U.S. medical care costs are incurred from chronic diseases caused by obesity, according to the Surgeon General's call to action to prevent and decrease overweight and obesity. The cost of obesity in the U.S. was more than $117 billion in 2000. The CDC has highlighted a study that estimates the annual cost to be between $147 and $200 billion. Obese adults spend 42% more on an average of $1,429 on direct health care and medical costs versus adults who are healthy and at a normal body weight. Obesity is associated with job absenteeism, costing approximately $4.3 billion annually, and lowers productivity while at work, costing employees $406 per obese worker per year. Costs for patients presenting at emergency rooms with chest pains are 41% higher for severely obese patients, 28% higher for obese patients, and 22% higher for overweight patients, more than healthy weight patients. Again, there is a wealth of data available out there regarding the costs of obesity on the healthcare system. To sum up what H.R. 3207 is exactly trying to do, this bill is authorizing a national initiative to attack a major health problem in the United States that cannot be remedied through the healthcare system alone. The activities must include training health professionals, educating the public, and developing and demonstrating intervention strategies for use at work sites and in community settings. This bill seeks to provide the first national strategy to combat the epidemic by directing the CDC to do three things. First, train health professionals to recognize the signs of obesity early and to educate people concerning healthy lifestyles such as proper nutrition and regular exercise. Two, they must conduct public education campaigns about how to recognize and address overweight and obesity. And three, develop intervention strategies to be used in everyday life, such as in the workplace and in community settings. The specific intent for this bill is to eliminate many of the most serious health conditions, not only to reduce overweight and obesity, but also to encourage a healthy well-being through nutrition and physical activity. With any proposed policy, there is always the possibility of unintended consequences. H.R. 3207 regards obesity as a public epidemic, which means the public needs to be on board. This bill outlines specific programs and activities that address this important issue. There may be resistance from the public to treatment and assessment programs that combine dietary and behavioral modifications. Opposition in identifying obstacles to nutritional eating habits and suggesting alternative food choices. Parental involvement is lacking or non-existent for children and adolescent recommendations and treatments. Healthcare providers are not able to maximize their time with patients to be able to guide patient counseling and refer to programs. Communities and healthcare settings do not facilitate change at the individual, environmental, or policy level, and unidentified links between one's personal and social environment. These are all difficult to consider objective unintended consequences. The bill was not enacted, and there is an overwhelming amount of evidence and data supporting the need for this bill to be put into legislation. How much money a program like this would cost in a fiscal estimate here shows that H.R. 3207 would provide $25 million to the Centers of Disease Control and Prevention for a coordinated national effort to reverse increasingly sedentary lifestyles and diets that are high in fat and sugar. Here too is a 2008 study by the Urban Institute, the New York Academy of Medicine, and the Trust for America's Health, which found that an estimate of $10 per person in a proven community-based program to increase physical activity and improve nutrition could actually save the country more than $16 billion annually in just 5 years. The study also showed that out of the $16 billion, Medicare could save more than $5 billion, and Medicaid could save more than $1.9 billion. Here's just another quick slide of previous costs related to this type of issue to show how much a program like this could cost. This is a fiscal history of a chronic disease prevention programs by the Division of Nutrition, Physical Activity, and Obesity. This is 2013 and 2014 that shows the millions of dollars provided by the government to help fund some of these programs. Stakeholders are the power behind any policy. Obesity and public health are extremely hot topics because they are so significant and central to America's overall health care. Highlighted here are just a handful of potential stakeholders and opponents, and we'll quickly go through them The American Academy of Family Physicians, the AAFP, is dedicated to advancing the health of the public and plays a pivotal role in addressing the obesity epidemic. They develop evidence-based and initiative practical tools. The Robert Wood Johnson Foundation is the nation's largest philanthropy dedicated solely to health. The nonprofit Nutrition Coalition was created by John and Laura Arnold. They are self-made millionaires and are able to place lobbyists in the White House and score face-to-face meetings with top officials in Congress. They're able to push for many issues related to nutrition, and they have spent hundreds of thousands of dollars investigating the causes of obesity. Wisconsin, here, the Wisconsin National Physical Activity and Obesity State Plan. Wisconsin does a remarkable job recognizing and addressing that obesity is an epidemic, and there is a tremendous of resources and correlations available in Wisconsin. The Physicians Committee for Responsible Medicine is highlighted here because they were filing a lawsuit against the government. They filed a lawsuit in January of 2016 in a California federal court claiming a violation of the Federal Advisory Committee Act, which prohibits special interests from influencing the decisions of committee members. Is important because it ties in some of the opponents for HR 3207, which would include big food and politics. All of these are huge influential industries. They are government and political committees and organizations, and each of these opponents could play a very important role in America's public epidemic of obesity. Recommendations. The American healthcare system is in the midst of a major transformation. As an American citizen and studying to become an advanced practice provider, it is important to realize that the healthcare setting provides a unique opportunity to assist the public and patients to improve physical activity and nutrition habits, ultimately having the ability to allow Americans the chance to achieve and maintain a healthy weight and well-being. This bill provides for a national program to conduct and support activities where healthcare providers are able to advise patients on the recommended level of physical activity and healthy eating guidelines. This can be achieved by giving consistent, evidence-based messages to all adults and children regardless of their weight. Patients need to adhere to a written care plan that is agreed upon by the medical staff and the patient, which sets small, achievable goals through tools for self-assessment and recording of eating and physical activities. I appreciate you all for listening to this issue, and I hope I was able to shed some light on House Representative Bill 3207. Thank you.